Last week, US President Donald Trump issued some health advice to pregnant women to avoid paracetamol, an ingredient in certain pain relief drugs that had medical experts rushing to clarify the science. The advice came from a report ordered by US Health Secretary Robert F. Kennedy Jr. He's the one behind the Make America Healthy Again movement, and he's driving some big changes in the US health industry. So, in this Squiz Shortcut, we will take a look at why last week caused such a stir, who RFK Jr. is, and what his agenda means for the rest of the world and to us here in Australia. Squiz Shortcuts is the backstory to the big news stories. I'm Larissa Moore.
And I'm Andrew Williams.
Andrew, President Trump is no stranger to making controversial announcements, but the one he made last Tuesday caused a lot of confusion and panic amongst pregnant women, not only in America, but around the world.
If you missed this, Trump told pregnant women to not take Tylenol. That is a widely used pain relief drug that is sold in America with the active ingredient of acetaminophen, which is paracetamol. That's how we know it. In Australia, It's the same thing. So Trump said that the US Food and Drug Administration would be advising doctors that the use of paracetamol during pregnancy can be associated with a very increased risk of autism. That was his exact quote. And his advice for women in pain was to fight like hell not to take it unless they had a very, very high fever.
As you can imagine, did not go down well. Medical experts were very quick to respond. In Australia, acetaminophen, which as you said, we know as paracetamol, that's how we'll refer to it throughout the podcast, is of course the main ingredient in Panadol, which is a super common brand of painkiller. Anyone who's ever had a headache, which I think we can all say we have had in the past, or a high temperature, not just pregnant women, know that it's used to bring down a fever. Here, the medical advice for expectant mothers is that paracetamol is safe to take in recommended doses during pregnancy. That hasn't changed.
No, medical experts were quick to reassure women that paracetamol is the most effective way to bring down a fever, and that's because if it's untreated, a fever can be dangerous in pregnancy. It's linked to things like miscarriage, premature births, and developmental issues. But even though doctors responded fast, it did cause some panic amongst women in the US and then here in Australia. And then if you multiply that by every country in the world that those medications are sold in, you can see why this announcement created a stir.
Yeah, really big news, which is why we're here doing a shortcut on it, of course. So the findings that he was talking about pointed to studies commissioned by US Health Secretary Robert F. Kennedy Jr., RFK Jr., as we'll refer to him as he's known. These studies involved some top universities like Harvard. They found that there's a possible association between mothers who've reported taking paracetamol during pregnancy and a slightly higher rate of neurodevelopmental issues in babies. But they haven't found concrete confirmation that the drug is the cause of autism.
They couldn't discern whether developmental issues were caused by the fever that the drug was being taken for in the first place or the paracetamol that was used to treat the fever. So the US Food and Drug Administration summed it up last week by saying that there's an association in some studies, but no causal link has been established.
And that's a key point. Experts say it's very hard to pinpoint a single cause of autism. Things like genetics, the age of parents, pre-existing conditions like diabetes, they're all believed to be factors. Just in case you're not familiar, autism or autism spectrum disorder is a neurodevelopmental condition that affects how a person's brain develops and functions, and it covers a really wide range of traits.
Yeah, for some people it means more profound issues like being nonverbal or being unable to cope with certain sensory things like loud sounds and bright lights, but then there are milder cases as well where people might have differences in the way they learn, or they might have difficulties in expressing themselves or understanding generally understood social cues and norms, and that can sometimes be interpreted as behavioural issues.
That's a really top-line explanation of what's a very complex condition. We'll put some info in the show notes if you do want to read more about that for yourself. But this focus in the US is on what Trump is calling an epidemic of autism, and that's come from the rise in diagnoses over the last 25 years.
So the latest Centers for Disease Control and Prevention, or CDC, report found that 1 in 31 children are being diagnosed. That compares to 1 in 150 children back in 2000. But experts put that rise down to the fact that people are more aware of the condition and screening has improved. So parents and schools are now more alert to the signs, and that means that diagnoses are being made much earlier in life.
Yeah, so the data is really about the increase in these milder cases. That's what they're talking about. Something we're seeing here in Australia too. Autism cases rose 42% between 2018 and 2022.
It's one of the fastest growing categories of NDIS plans. Children diagnosed with mild autism are staying on the scheme long after their early intervention period, and that's led to massive cost blowouts in the NDIS. It's a big factor in why the Albanese government is planning to restructure the scheme. It wants to move children with mild autism into a new early support program that is separate to the NDIS. This was controversial when it was announced recently by Health Minister Mark Butler. It caused a fair bit of confusion among parents who were concerned that their kids still need help and maybe you weren't going to get it.
So that's to say there's a bit of a parallel happening here with the rising diagnoses of autism, uncertainty about what's driving the numbers, and also healthcare in general being a political flashpoint. In America, a lot of that political heat is coming from the Make America Healthy Again movement, or MAHA, as it's known. Bit of a riff on MAGA.
Yes, and much like MAGA, it's a disparate group of people that are all kind of coming together under the one banner. So we've got some health-conscious parents who are worried about what their kids are putting into their body. We've got people who are anti-vaxxers or heavily against vaccination or sceptical about it, and people who generally just distrust big institutions like pharma companies and public health agencies and the advice that they give. So the plan of this disparate group is to reform America's food, health and scientific systems to identify the root causes of the chronic disease epidemic and make America healthy again. Now, that's just not a slogan. That's the wording that is now on the US Department of Health and Human Services website.
Yeah, this MAHA group have really rallied around RFK Jr. since he was appointed health secretary by Trump. There's been some commentary this week from political analysts with the view that Trump's announcement about Tylenol was a lot of appeasing that group.
Yeah, we've mentioned that medical experts have been critical of the president for sowing what they called confusion and panic amongst expectant parents, but for the supporters of this movement, it was validation that their concerns were being heard and acted on at the highest level of government at the White House. Yeah,
it's another example of how health is being politicised, heavily politicised in the US, and it's important to know who is driving it. So, up next, we are going to get you up to speed with RFK Jr., what the changes he's making could mean for the rest of the world and for us here in Australia. Andrew, RFK Jr. is a Kennedy, very famous name in American politics. He is the son of the former Democratic politician Robert F. Kennedy. He was known as Bobby. He ran for president in 1968. He's also the nephew of former President John F. Kennedy.
Yeah, this family has a very prominent place in American political history, and both the men that you mentioned, his father and his uncle, were assassinated in the 1960s. JFK in 1963 when he was president, and then RFK in 1968 when he was running for president. And RFK Jr. was 14 years old at the time. So, like Trump, he's grown up in one of America's most influential families, albeit on the other side of politics. And also, like Trump, he's no stranger to courting controversy. He's become known as one of the world's most vocal activists against vaccines.
Yeah, he has spent decades campaigning against childhood vaccines and more recently COVID-19 vaccines, even after his claims were disproved by medical evidence. It's not just his views on vaccines that have had him in the headlines over the years, though.
No, one thing that frequently gets brought up, and we think it adds to the sort of overall picture of the man, so we'll tell you about it here too, is his freezer full of roadkill, which he keeps to feed his pet falcons. And that only came to light after he admitted to illegally dumping the carcass of a bear cub in Central Park, New York.
Of course.
Pretty big park back in 2014. So he said he'd been collecting roadkill for years, and he saw the cub that had been hit by a car and he picked it up, decided he didn't have time to preserve it once he'd picked it up. So he dumped it in Central Park and positioned it to make it look like it had been hit and killed by a cyclist. So as you can imagine, the spectacle or even just the idea of a dead bear cub in the middle of a New York landmark made the news, and he had to fess up.
It is such an odd story. Of course, it went viral. We just wanted to cover it off so that you had it, because it always comes up when people mention RFK Jr. It's something that has given plenty of ammo to his critics during his subsequent political campaigns and in his bid for his current posting as head of US Health. A big job.
A very big job. And the US does have a number of very significant issues when it comes to health. It has extremely high rates of obesity, chronic disease, as we mentioned before. RFK Jr. himself has said that Americans were healthier when he was a kid, or that's his view, and he's trying to bring the country back to that standard. And in just a few months, he's made some big changes. He's banned artificial dyes in foods. He's argued they're linked to hyperactivity and violence in schools. Now, the evidence on that is patchy, especially given that there are a lot of foods that bright, colourful dyes are found found in that also contain large amounts of sugar. So think lollies, ice cream, kids' cereals. Sugar is also linked to behavioural issues, but the dyes are the specific concern of this Make America Healthy Again movement.
But recent polling does show that Americans are broadly in favour of his agenda on food and to improve food safety guidelines to make them easier to understand. But his stance on vaccines has significantly less support amongst the general public.
Yeah, that's what the most recent polling shows. So he has long argued that childhood vaccines like MMR, so that's for measles, mumps and rubella, aren't safe. So the World Health Organization has pointed to a rise in measles outbreaks, particularly because of hesitancy around taking vaccines.
And America is a big part of that. Parts of the country are currently experiencing measles outbreaks, but Kennedy has continued to question whether children need the shot.
And that goes in the face of the medical advice, so the prevailing medical advice that vaccines are safe and the health risks associated with measles are far worse. So it's got medical experts around the world, as we said, and here in Australia worried. Public health officials say that Kennedy's continual messaging that vaccines are dangerous is undermining trust. That could lead to parents avoiding vaccines or pain relief when it's needed, and that results in more preventable illness, hospitalisations, and even deaths.
But he's pressing ahead. He recently fired the head of the CDC, Susan Menares, because she wouldn't pre-approve the recommendations of his vaccine advisory panel. And this is after he fired the original panel in June. That current panel is now stacked with people who've expressed anti-vaccine views. That's not all. There are heaps more changes ahead.
Sure are. That panel is in the process of reevaluating the vaccine schedule for hepatitis B and the MMR vaccine for children, as well as the COVID-19 vaccine. And there's also moves afoot for the FDA to revoke approval for the polio vaccine.
As for what his political opponents are saying, former Democratic presidential nominee Hillary Clinton put it pretty bluntly last week, saying Trump's government was sowing confusion. Her quote was, "When your president says something, when a Kennedy, who's the secretary of HHS, says something, what are you supposed to believe? Too many Americans are listening to this very destructive anti-science tirade that we're hearing from this administration, and it's going to cost lives. It is already costing lives." That was her quote.
And as we've said, one of the reasons that we're talking about this is because when America shifts direction, the ripple effects of that are often global, not only in terms of health, but also trade and pharmaceuticals and all those sorts of other things that do affect us here in Australia. But predominantly, it's got medical experts here worried with respect to vaccine hesitancy, so that this rhetoric will influence how people approach vaccines in Australia as well, and how that will then lead to the spread of infectious diseases. For the moment, though, Australia is keeping calm and sticking to the science.
Especially when it comes to paracetamol. So let's just loop back around to that. The message from the Therapeutic Goods Administration, the TGA, is clear. Paracetamol remains safe in pregnancy when used as directed. The risks of leaving a fever untreated are much higher. And if you've got any doubts, see your doctor. That is our shortcut on the push to make America healthy again. Now, each week we like to give Squiz's recommendations for further reading, listening or watching. I am going to recommend an episode of the New Yorker's podcast, The Political Scene. It's called How MAHA is Sowing Vaccine Confusion. Covers a little bit more about what's been going on at the CDC and the politicisation of health in the US.
And I've got an article from CNN which fact-checks the claims that Trump made in his statement about Tylenol last week, and then we'll also include the link to the full announcement that he made so you can compare and contrast.
We'll have links, of course, to those in your episode notes, along with some information about autism that I mentioned earlier. Now stand by for our Ask the Squiz episode out this Thursday. Andrew and Claire will tackle questions sent in by you guys. If you've got a question for a future Ask the Squiz, maybe something small that wouldn't make a full shortcut, maybe something you'd like rounded off about an old news story, maybe something quirky, send it through. And as always, anything you'd like a shortcut on, shoot it through to hello@thesquiz.com.au.
And also a reminder that we're on YouTube, so you can watch our Shortcuts podcast, the Weekly Wrap podcast that Claire and Jodie do over on the News Club channel. If that's how you like to get across your content, or you just like seeing our faces,
just search for the
Squiz. Yeah, on YouTube. And you can do just that.
Thanks for listening. We'll be back next time.